The Ottawa ankle rules indicate when radiographs are needed for the foot or the ankle. Indications for the ankle include tenderness at the posterior edge of the distal 6 centimeters of the lateral malleolus, tenderness of the medial malleolus, and or inability to weight bear for 4 steps. Indications for the foot include tenderness at the base of the 5th metatarsal, tenderness over the navicular, and or inability to weight bear for 4 steps. The test item cluster for patients that may benefit from spinal stabilization include age less than 40 years old, average straight leg raise greater than 91 degrees, aberrant motion, which includes pseudo-Gowers sign, painful arc, reversal, lumbo-pelvic rhythm, instability catch, and then the last one is positive prone instability test. Okay, Katie, I want you to rest your hips at the table and go ahead and lay flat. I'm going to feel and let me know when you have any pain.
Right there.
Okay, go ahead and hang onto the table and lift your legs up straight. Is the pain changed at all?
Yeah, it feels better.
The test item cluster for patients likely to benefit from spinal manipulation include symptoms less than 16 days, no symptoms distal to the knee, FABQ work subscale is less than 19, at least one hypomobile lumbar segment, and at least one hip internal rotation is greater than 35 degrees. The McMurray test checks for meniscal pathologies. To test the medial meniscus, you're going to externally rotate the tibia. And to test the lateral meniscus, you're going to internally rotate the tibia. The anterior drawer test, which checks the integrity of the ACL. The slump test is a lower limb neurotension test. Go ahead and place your hands behind your back. Go ahead and slump your shoulders. Tuck your chin to your chest. I'm going to apply some pressure. And I'm going to extend your knee and then flex your ankle. Go ahead and look up. Have your symptoms changed at all? The test item cluster for patients with hip osteoarthritis includes self-reported pain with squatting, pain with active hip flexion, pain with active hip extension, passive hip internal rotation is less than 25 degrees, and a positive scour test, which specifically in the internal quadrant. The Faber test is used to assess the hip joint, the SI joint, or the iliopsoas muscle. The Elise test checks for tightness in the rectus femoris. I would compare it to the other side. A diagnosis of gluteal or hamstring weakness may present with isolated weakness in hip extension, abduction and external rotation, isolated knee flexion weakness, a positive Trendelenburg sign where the uninvolved hip drops, normal reflexes and sensation, and possible active range of motion deficits due to weakness. A diagnosis of L5-S1 radiculopathy may present with radiating pain in the lower extremity, sensation deficits in the L5-S1 dermatome, myotobal weakness in plantar flexion, knee flexion, and great toe extension, diminished or absent Achilles tendon reflex. They'll have a positive straight leg raise, a positive well leg test, which the symptoms would be in this leg for the straight leg raise, and then this leg for the well leg test. They'll have a positive slump test and abnormal imaging.